Hi, this is Dr. Kristen Titko from the Center for Foot Care, and we're going to talk a little bit about neuropathy. Damaged nerves, neuropathy. In the foot, it can happen from several different things. The most common is diabetes, but alcoholism, malnutrition, lack of B12, thyroid dysfunctions, and spinal injuries or spinal conditions can cause neuropathy in the feet as well. In most cases, neuropathy will start in the toes because that's the furthest away from your spinal cord. And that neuropathy will move up the foot, the ball of the foot, the arch, the heel, and up the ankle if left untreated or unchecked. The good news is there are treatment options for most of these conditions. You might notice it in one foot, but usually, especially in the realm of diabetes, malnutrition, alcoholism, it'll be in both feet. And it's usually symmetrical, meaning both feet feel the same. What does neuropathy feel like? Well, that's a hard one to explain because it's really hard for most people to describe it. And that's because their nerves are damaged and not sending good signals to the brain to tell the brain what it feels. But most people will describe neuropathy as a pins and needles, a numbness, like when my arm falls asleep if I sleep funny, stabbing, burning, a hot poker feeling, and it doesn't start and last all day. Usually it starts intermittently. You might notice it more at the end of the day or when you're in a resting position, but over time, again, if left untreated, it will be more persistent and more intense. The danger of diabetic neuropathy or neuropathies of other types is that eventually, although painful at first, your nerves will go completely numb, and then you can't feel damage that happens to your feet. You may not even know that you bumped into a door or your bedpost. You may not recognize that you dropped something on your foot. You may be wearing shoes that are too tight that are causing sores, cuts, openings into your skin, and you don't sense it. You might step on something and not notice that you've stepped on something. See drops of blood on the floor and you wonder where those are coming from. And in advanced cases, you can actually form a hole or an ulcer on the bottom of your foot, usually the ball of the foot, or between the toes. And that ulcer or hole is open and susceptible to infection. Up until recently, the best treatments we had for neuropathy were pills. Pills like Neurontin, gabapentin, Lyrica, Cymbalta. You've seen some of these advertised on TV. And they can help to stop the signal of pain from getting to your brain. So the mechanism by which they work is that you don't feel the pain, or you're not supposed to feel the pain, of your neuropathy. But they don't treat the problem. They just cover it up. At the Center for Foot Care for the past 8 years, we've been using treatment that actually reverses nerve damage, makes your nerves healthy again, so that you are less susceptible to danger, trauma, injury, infection, and sometimes loss of body part. Our treatment is twofold. It's a short-term use of a medication that helps to improve your nerve health. It's a nerve supplement. It's a prescription, but you don't have to take it long-term. And in conjunction with that, we use our laser therapy. And our laser therapy works by increasing blood flow, stimulating blood flow targeted towards your nerves. And that increased blood flow brings in the nutrients, the healing factors, the proteins that we need to actually reverse nerve damage. Our treatment this way has a 90 to 95% success rate in helping to alleviate, resolve, or improve the pain or the symptoms that you're suffering from. Lots of people tell us that they sleep better at night, their feet move less, they feel more sure when they're walking because they can feel their feet better. And we want to help you know that there are answers. And we want to help you at the Center for Foot Care. Come see us. We measure health by the foot.